Hi, I'm Dr. Ryan Edwards with Windermere Dental in Cumming, Georgia. Infection control is a very serious issue in healthcare today because there are many diseases out there which can have a negative impact on your health. Occasionally, the media reports stories of patients being unintentionally exposed to such diseases while at a healthcare facility. We at Windermere Dental go to great lengths to make sure that you and your family are safe when you visit us here at our dental office. Today, we'll show you our Sterilization Center, as well as many technologies and techniques we're using to sterilize our instruments before you arrive. This is our Sterilization Center. You'll see it in the main hallway at our office. Instruments are brought into the Sterilization Center on the left side, where you see the red light, and they progress to the clean side, designated by the blue light. If you've visited our office before, you may have noticed that most of our instruments are contained in these metal trays or cassettes. Storing the instruments in the cassettes reduces the risk to the staff of getting poked with dirty instruments while transporting them. And by keeping the instruments separated inside the cassette, all the surfaces of the instruments are exposed to the cleaning solutions and hot steam when sterilized. If instruments are ever bundled like this, the steam in the sterilizer cannot penetrate to the middle and all the surfaces may not truly be sterilized. Once instruments have been used, they are brought to the dirty side of the Sterilization Center and are placed inside our thermal disinfector to begin the sterilization process. If the disinfector is running, dirty instruments are stored in the dirty cabinet until they can be loaded into the disinfector. You may notice that our cabinets open and close by a pneumatic foot pad. This further reduces the potential for the spreading of germs by keeping the cabinet doors hands-free. Though it may look like just a fancy washing machine, the thermal disinfector is a hospital-grade instrument cleaner. The racks provide places for the cassettes to sit securely, and the basket is used for other instruments. The machine cleans the instruments with a water rinse, followed by an acid and base detergent wash. Finally, the instruments are held at 200 degrees Fahrenheit for 10 minutes. If you happen to see us open the door when it has finished a cycle, you'll notice a fair amount of hot steam coming out. At this point, 99.99% of the microbial load has been removed from the instruments. Once the instruments have been treated in the thermal disinfector, the instruments are ready to be completely sterilized. Sterilization is necessary to ensure that all forms of life have been removed from the instruments. This would include hardier forms of life, such as tuberculosis spores. Once removed from the disinfector, instruments are wrapped and are then placed on these shelves to indicate they are ready to be sterilized. Instruments are heated in our sterilizer to approximately 275 degrees Fahrenheit at a pressure of 33 pounds per square inch for about 40 minutes. The sterilizer is kept in good working order with regular maintenance, and testing is done on a regular basis to ensure that it is functioning properly. At the end of the sterilizer cycle, the instruments are removed and placed in the clean cabinet to cool. Once the instruments are cool, they are ready to be used to treat your smile. I hope this video answered any questions you may have had about how instruments are processed at our office. If you have any other questions, feel free to leave them in the comments section below. And of course, if you need help smiling, feel free to give us a call. Our contact information is available on our website at www.windermeredentalcare.com.